Hi there. Welcome to Real Talk, a space where psychology meets culture, community, and unapologetic truth. We are Dr. Denise Watkins and Dr. Erica Dawkins, two Black psych types at different stages of our careers. We're here to unpack the real life issues that impact our mental health, relationships, and resilience in a revolutionary way. From trauma to triumph, therapy to theology, we hold spaces for healing, growth, and the conversations we feel our communities deserve. This is Real Talk, raw, relevant, revolutionary, and rooted in love. And so today we're getting into something that comes up all the time, especially inside therapy rooms, definitely more so on social media. I feel like blowing up on social media, but also in our families and even in our own heads. And that's the myths that we've been taught about therapy itself. And so for a lot of people, therapy can feel really mysterious. It can feel intimidating and even unnecessary. And so you might have heard things like therapy is only for people who are really struggling or going through something, or if I talk about it, it'll just make things worse, or even that a good therapist will tell me exactly what to do. And not quite. And so, but these ideas don't come from nowhere, right? They usually are shaped by media portrayals of therapists in movies and in shows, different cultural messages about strength and privacy and resilience, even stigma around mental health that gets discussed, and very importantly, a lack of real access to quality, accurate information about what therapy actually is. And so we're hoping to be able to navigate that together. In today's episode, we're going to break down some of the most common therapy myths, talk about why they're so widespread, and essentially how these myths can quietly stop folks from getting the support that they deserve. And because when therapy is misunderstood, it doesn't just stay a misconception or a misnomer, it becomes a threat, and especially a barrier, and one that we want to address. And so if you've ever wondered whether therapy is quote unquote for you, or felt nervous about starting, or even doubted whether or not it could really help, then this conversation is for you. So let's get into it. So one of the first couple of myths that we'll cover are some myths that folks have about therapists themselves. So myth number one is that therapists have their lives completely together. And I wish this was true.
Yes. I couldn't hold the laugh back. I could not hold it back. Because that's not necessarily true. It depends on who you're asking.
Absolutely. And I think from just thinking about kind of our different places, I feel like sometimes, at early career, you think like mid-career and late career therapists do have their stuff together. But I think what we learn over time is that therapists are just as human as other folks. They are not superhuman. They are not magicians, and don't have some like special power to get things and keep things together. But they are folks that believe in the work, hopefully, right? And are actively doing the work themselves, which is why I think it gives that appearance.
Absolutely. I mean, I think doctor in itself, whether it's, you being a medical doctor, it like puts you in this position of power, right? Where people automatically assume, oh, you've got to have it all together, or you know it all, or you know what to do, right? But unfortunately, we are therapists. We can't give ourselves the therapy, right? So one of the, important things is that we're seeking out, ways to cope, ways to give self-care. But even if you are interested in therapy yourself as a therapist, to pursue that. But I think a lot of people think like, we just know it all, so why do we need that, But how can you do it on your own?
Absolutely. It's like a surgeon trying to perform their own surgery. It just doesn't work, right? I do think for therapists, though, that one of the things that we see in the field that is shifting is this desire to present yourself always as what we would call like blank slate or even perfect. And I think sometimes our attitudes about what a good therapist looks like presenting to the out world can put undue pressure on ourselves or on our colleagues to look and to make healing or being healed, even though I hate that, this idea that healing isn't a continual process, but like looking like therapy works to be perfect rather than to be progress.
Yeah. I think that's one of the things that I like latched onto pretty quickly when I was in training is like, I didn't like the blank slate. I'm a very expressive person. Like even when we're having conversation, I feel myself expressing and emoting a lot. So, when I think about like clients, I think about like, how would I want to be approached? Absolutely. And we are people, we can show our personhood. Like we don't have to kind of like lock ourselves away from the people we're working with. But, in a boundaried and appropriate manner, you can emote, you can express yourself, and you can surely answer questions that people ask you, as long as they're not too personal, right? So I think it's very important that we kind of break down that notion of like, you have to be perfect because it's not real.
Right.
Mm-hmm.
Yeah. Now, your therapist should not be in your session in real time talking about their problems, right? But you should rest assured that they don't have their lives fully together.
Right.
But talking about ways in which they don't is not necessarily appropriate. It's not at all appropriate for your session.
No. But being, able to be human, right?
Yes. 100%.
Which is being able to express yourself or being able to kind of be authentic and personable without kind of being like a monolith or something.
Right.
Yeah.
Absolutely.
But you also made another good point, which is it's not just like therapy that can be helpful. It's also supervision in that. Before you are a licensed practitioner, you can supervise. So I am supervised, and I think that having a supervisor has grown me leaps and bounds. But it's an ability for you to kind of like reflect on the work that you're doing and to, talk about like, what are the feelings that are coming up as a therapist? What do you think is happening with the client in the relationship? So that you can bring in the pieces of yourself that are real, but do it in such a professional manner that it actually aligns with like the work that you do, the approach that you take, and helps to kind of move the therapy along in like a positive progression.
Absolutely.
So, the next myth, therapists are going to judge you, which is not necessarily true as well. So I think people unfortunately kind of like mix up judgment and like accountability. Judgment is like when you look at somebody like, oh goodness, like what are you doing? Versus like holding someone accountable is letting them know, hey, when you did this, it made me feel this way. And so judging is kind of like a shameful thing, whereas holding somebody accountable is kind of like calling them in, as Dr. Dawkins always likes to use, is like calling them in and bringing them in to work on it together, right? To come to a resolution and to move forward. So if you're a therapist who's, approaching things in a very thoughtful manner, an intentional manner, you're not judging your client. You may challenge them, you may confront, right? You may bring things up as a way to like reflect, but are you judging their behaviors or attaching shame or blame? That might not be helpful. That may be more harmful. I think some people kind of shy away sometimes from the therapeutic process because they have a fear that they could be perceived in a shameful manner, right, or be judged. But I think that depends on who you're working with and how they decide to approach accountability. So there are some cultural things around like judgment, right? In certain cultures, shame is seen as like a way to kind of like correct behavior. Sure. Yeah. Shaming, like especially like around children, but even with adults, like shaming, maybe not, doing things along the timeline that is culturally appropriate. And so I think as a clinician or even as the client, it's important to talk about like those cultural experiences. Like, how did your background, your ethnicity, religious beliefs, your spirituality, even gender or sexuality, how does that kind of like play into fear of judgment? And is there like some stigma that may be attached to identity factors that could make someone shy away from being judged, or furthermore shy away from like being in a therapeutic process? So I don't know if you want to expand on that any more, like how diversity could like affect the way someone would feel about that.
Well, I think before diversity, I think one thing to maybe underscore from the therapist point of view, you mentioned what we oftentimes are trying to draw attention to is one's goals, right? So if your behavior or what you might bring into therapy is not in alignment with the goals that you've set, or how you'd like to live your life, how you'd like to actualize your best self. Part of what we're doing is just calling attention to that and said, like, you'd like to be able to do X. Does Y allow you to get to X better, differently? How do you feel about how Y is impacting your ability to arrive at X, right? And so oftentimes it is holding up a mirror and kind of saying like, look at what you told me that you'd like to do and see, and does your behavior align in that way? We oftentimes are also looking at things like maybe previously adaptive behavior. So there was a point in time or your life where the behavior that you engaged in was helpful, it was protective, it allowed you to survive and navigate the world, and now it's not as useful, right? And so we're challenging and looking to be able to call attention to tools that are maybe more useful for the time period. I think also one of the things that we have to think about is therapists are human, again, like we talked about at the very beginning, right? And that there might be beliefs that they have, and the therapist, like you mentioned, in terms of supervision and doing their own work, should be working to check those beliefs, to be transparent about ignorance or places that may stunt their ability to navigate things with the client.
Mhm.
And I think a therapist that's not able to do that, or that touts having no challenge doing that, is someone that hasn't been doing their own work. And so
Yes.
again, it's not from a place of judgment, but we all have our own histories, beliefs, biases that may impact the work that we do. And it's okay to say, I might not be the best fit for you because I
Yes.
haven't done that work, or I know that I need supervision or guidance
Mhm.
to be able to move clients accurately through a place.
Absolutely, yeah. It's important to recognize that it can come. It's not just about a client feeling judged. It's also about the therapist being mindful and intentional about how any of their beliefs or their approach could come off as like shameful or
Mhm.
judgmental. Um,
Absolutely.
yeah.
All right. So one of the last myths that we have about kind of therapists themselves are all therapists are the same. Now, hopefully, as like folks get more acclimated to how therapy can be navigated or appears, that you see that therapists are not the same,
Yeah.
not just in kind of the outside appearance or their approach to the work, but also the ways in which they think about even navigating similar modalities. And so while it can be helpful to find out if a therapist ascribes to something like CBT, cognitive behavioral therapy, or more psychodynamic or psychoanalytic approaches, it is also important to remember that they may navigate those differently.
Yes.
They might find themselves like, I consider myself to be primarily cognitive behavioral, but also incorporate some aspects of systems work as well as narrative work, and really find that with particular clients, even things like emotion focused therapy or relational work is important. And so I consider myself more of an integrationist, but one that leans heavily on behavioral pieces.
Yes.
And so I may not look the same, to someone who, or as the same as someone who might also primarily be cognitive behavioral.
Yeah, I agree. I love CBT, but I also am, I would say, eclectic and integrationist, like Dr. Dawkins. I work from a primarily relationally and psychodynamic, but I have pulled from things like DBT, CPT. I've used with clients, ACT, which is acceptance and commitment therapy. Every therapist has a different training modality that they feel they are an expert in, or is it their specialty. And so when you're looking for someone, it's important to research those modalities to get a better understanding, but it's also important to understand like how those things might address the symptoms that you're looking to explore or lessen.
Absolutely. And so each therapist may lean into a particular modality, or even ways in which they engage in that modality based on their identity, based on their own experiences, either in training, right? We all can't unfortunately be trained in the same place. And so we have different training institutions that maybe introduce different ways of approaching things, in addition to maybe the things that they experience over the course of their lifetime as a therapist. Like once they are starting to practice, they may encounter things that completely change the way that they may approach a particular way of treatment. And so all of those things quite nuanced, but it go into therapists not really being the same. And so it's important to consider how your therapist might approach the work that you need, and really think about fit and goodness of fit when it comes to the therapeutic work.
Yeah, it's very important for us to be forthcoming if we think, there may be somebody who is more well suited, providing a referral is okay. So, if all therapists aren't all the same, that also means that therapy itself isn't always what other people think it is. So, in this next segment, we're going to talk about like what therapy is and is not. So the next myth is therapy is only for serious mental illness. Not really. Obviously, I think there's like a media that has permeated our society that has shown like people who are seeking out mental health care are individuals who are like inpatient, right? And that is just one segment of mental health care.
Sure.
In fact, there's outpatient. There is, a million different modalities and approaches that can be taken when someone is looking to reflect. It's important to understand that, you don't have to be in a crisis. You can simply want to do supportive type therapy, which is coming and talking with someone and being able to reflect on experiences that you're having in order to just kind of like increase and improve your daily quality of life. There's kind of this understanding that it's only for if you want to fix a relationship, if you're going through some type of life transition, but that's not necessarily the case. You can come and focus on your friendships and your important intimate relationships, but you can also come to focus simply on the relationship with self. You can come because you may be new to college, or you just had a baby, or you're getting married, or any of the things that could be happening in your life that are important. It does not just have to be around fixing something. There's a difference between like preventative mental health and then crisis only. So crisis is when someone is in a mental health emergency, right? And we need to get them care. But preventative care can look something like, oh, I noticed that my mood has been shifting a lot lately. And, I feel okay, but maybe it would be helpful to have someone to talk to. Or, I noticed that maybe medication is something that might be helpful. Maybe I should talk to someone about like the options that are out there. So when you're trying to do something preventatively, you're doing it before, the fire starts, right? Where if anything, we're trying to like douse the fire or make it impossible for it to start. And then thinking about like stigma, obviously in various cultural communities, there is some stigma around mental health. I think among most culturally diverse identity groups, there's not like a full acceptance, right? Especially, I can speak from my own experience in the African American community. It's not seen as something that is needed or necessary until a crisis occurs. And we want to break down that stigma. Part of the reason why we want to have this conversation is to break down some of that stigma in hopes that people realize that therapy can be a beautiful experience and improve your life all the way around the board. It doesn't have to be because you're experiencing an emergency.
Absolutely. I think one of the things that you speak on, especially historically around stigma in the African American community, is it's a trickle down effect from the medical community, right? Where Black and brown bodies were experimented on, where there's this idea, even still in the medical community, that there's a higher pain tolerance for Black and brown individuals, primarily Black women, and that there is not a need for as much resource. And I think because of what we think about in terms of how connected psychology or mental health is to the medical community, that stigma then often transfers and translates to mental health, that folks don't need care until things are severe and have gotten to be beyond one's own self-management. There's also a really dark history around talking about mental health concerns and going into the system, whether that be the justice system, whether that be child protective services in the system. So there's a lot of legit valid fear about engaging. And I think what we've seen over the years is more engagement of Black practitioners, or of previously marginalized and minoritized identities, realizing that there's a need for representation in the field and looking to position themselves so that there can be more safety and understanding and potentially advocacy for those that have shared identity to get support that they need to break down that stigma.
Absolutely, yeah.
All right, let's see. Our next myth is that a good therapist will give you all the answers. And so, this isn't a test, so there are no right and wrong answers. And I think that's what can make therapy challenging for folks that are just looking for solutioning. I think also we've also had this large influx of things like coaches that may be able to kind of say, try this thing immediately for real-time problems. But one of the difference between coaching and therapy is exploring kind of patterns of behavior, right? Therapy is exploring historical things that are influencing present day needs and emotions. And therapy is also one of the ways in which we help guide people to better understanding what could be most helpful for them. And so to be able to give you an answer is hard, because therapy really should feel like a collaboration. I share what my expertise is. I share my thoughts about what you're presenting and the goals that you'd like to navigate and potentially the best way to get there. But you have to communicate when that is working, when it's not working, when there's a need to pivot, when the goalpost has changed, when some of the behaviors have changed or other entities are influencing things like the therapeutic process. So it really should feel like a collaborative experience and not just being told what to do. Because I think the challenge is when it doesn't work, then you're looking at the therapist as opposed to us being able to say what's not working about what's happening here.
Yeah, and I agree. Like the onus then automatically goes on the therapist. Like, oh, well, what did you tell me or didn't tell me? And yeah, I mean, if we're looking for the person to grow, they're coming to us saying, I'd like you to help me with this. It can't be that you overwork yourself. And as an early career professional, I am learning this. It's like how to help the clients that I'm working with in a way where it actually is lasting change, skills that they can take forward once we terminate.
Right. We talk about transference of skill, right? How do I give you, or we give you what we have so that you can fire us.
Absolutely. You know, like, obviously there's all these different, ideas about like how long therapy should be. But, if someone is in a space where they're operating at the highest level that they feel they can, I think at that point, we've done what you said you wanted to do.
Right.
And so, yeah, it's not just about coming and saying, please give me all the answers, because there may be questions we don't have answers to, but we are willing to figure it out together as a team.
Yeah.
So.
And even if we might come to some solution around your current challenge by providing direction, then you're always going to be looking for something outside of yourself to be able to direct you, right? There's that external move towards direction versus an internalization of a certain skill set that allows you to problem solve, for you to say, here's how I emotionally regulate so I can think through the problem that's happening. Here's how I develop a pro-con list to be able to think about what's the correct decision for me right now with the information that I have. How do I then become comfortable with the decision that I've made? What is it like to sit in some of the uncomfortability or uncertainty of the decision, and then be able to then celebrate, in the outcome, right? And to be able to internalize that process so that it's not tied to what someone else has told you to do, and you don't really understand why it's important to do it for yourself.
Absolutely. Yeah. With that type of change, you'll leave feeling like what's best for yourself, and you're not relying on anyone else to tell you that. So the next myth is that therapy is just venting. And I would hope not. So, one of the things I think that is a misconception is that, we are there to just kind of listen. But that doesn't give credence to how a lot of therapists actually show up and show out. And it can be simply, asking certain pointed types of questions, the tone, right? The way that you show up in the room with the client. Operating as a witness, right? And not like a witness who's just actually observing, but like a witness who is a participant in what they're witnessing, in a way that they are actually allowing that person a safe space to explore, to regulate, to learn, to grow, to heal. So, venting is just allowing this person to talk. That's not what's happening. I would hope that if there are therapists who feel confident enough that they assert in a moment, hey, I'd like to just reflect on what you just said there, or, oh, I noticed that your face or your posture changed, your voice. Please tell me, what am I witnessing, or what am I seeing? What are you experiencing? It's important to do that as well, because it gives you more information about what the person is experiencing and helps you to really be able to focus in on what they need in that moment. And then it's skill teaching too, right? Yes. This is teaching coping mechanisms, grounding, but also allowing the person to kind of identify what are my triggers? What are the patterns that show up in my life? What are some of maybe the cyclical experiences I've had? And also be able to tap in and see when their behavior is changing, because that's when there is progress being made, when they can kind of capture, oh, I came in with a struggle around regulation, and now I find myself being able to pause before I react. So it's not just venting. There is a great processing that is occurring during therapy, but to some it may seem like a space where we just kind of let you let loose, and in some ways it is, but it's not that fully.
Right. And there might be variation in experience. I would say if there are some times that clients have come in and there's been so much that's happened in between sessions, and they do need a space to dump.
Yes.
And that the time that I might interject or might ask some of these reflective or process type questions to get them to think about what they're sharing with me, think about their emotions, think about the actions that they took, think about the consequences of those actions, right? Maybe more limited than maybe other sessions. But if that's happening more and more, if that's happening and that is the, kind of entirety of the work, that can be some of maybe the reason that folks don't feel like therapy is working for them, because you come, you dump, kind of like a trash can, right? You dump yourself out and then you just go back and fill yourself up, as opposed to growing or putting a liner in so you don't get dirty. You just come and share things without really thinking about how you can better understand yourself or others through those experiences. And so hopefully if you are having that experience where you find yourself venting or not really getting a lot of engagement, even in ways that helps you think through some of your responses or reactions to things, that you feel comfortable talking with your therapist about wanting to be able to do that, wanting to be able to better understand, and where you need them to potentially intervene more.
Yes.
All right, so next we're going to talk a little bit about just the process of therapy and expectations and try to demystify that and talk about some myths related to that. So the first one is if therapy isn't working, or if therapy is working, then you should feel better quite quickly. And therapy is a long process for a lot of reasons. And long, even in our time, could be brief therapy, which could be, 5 to 12 sessions. It could be a more traditional length of therapy, which we might consider 6 months to a year. And it could be long-term therapy, even twice a week, like psychoanalytic work or some more psychodynamic approach over the course of years. But you really want to understand like what therapy could and should look like with each intervention. And just because you're not feeling better quickly doesn't mean therapy isn't working. It also, one of the things that we think about is therapy doesn't happen in a vacuum. So you come and you spend 45 to 55 minutes with one of us, and there is this experience or this transference of knowledge, but then you have to go back and carry it out in the real world, right? In the real world, life keeps lifing, and environments don't necessarily change, but we're expected to change, and so it can feel like we're pushing up against some barriers that could prevent us from feeling the effects of therapy as quickly as we might like. And then, one of the other things that therapy does is it tends to create space for things that life doesn't really allow us to usually do. So you get 45 to 55 minutes by yourself to talk through things that you just have to push past maybe in other spaces and may not have spaces to talk about. And doing that like level of unpacking and processing can be exhausting and tiring and can feel heavy. And so it can sometimes feel like things are getting worse, or that you are more aware of the things in your life that are heavy before it can start to get better.
Yeah. And I think a lot of people think oh my gosh, get worse. But it's really just a level of emotional attunement and awareness that you want, right? But it can be tough to sit with at first, right? Which you build resilience to that over time. But yeah, I think social media has had a little bit of an impact, in addition to other media forms, about what healing is supposed to look like. And, like Erica or Dr. Dawkins has said earlier, right? Healed.
Yeah.
Healed with an ED, past tense, right? Healing. Right. Ongoing, continuous. And some people don't think necessarily like the idea of continuous, right? It would be nice if we could heal the wound and never have to deal with it. But I think that in reality, there's going to be something, right? Always. There's going to be a life experience. There's going to be a stress or something, right, that comes about, and it may be something that needs to be healed from, right? Or you need healing for. And so, I think it's unnecessary for us to place healing on a timeline. If we're continuously healing, there's no stopping. It continues for life.
Right. I think we really try to focus on acquisition of skills to navigate challenging situations. Like as soon as you said, there are things that we're always going to go through. I think about the individual challenges that we might experience as well as the collective challenges. Like right now, and I feel like I say this to a good friend of mine every day. I feel like we answer calls like they're actively trying to kill Black women. They're actively trying to kill Black women. And right now it feels more real than ever. And to me, I don't know if that realization is something that I could ever heal from. There's constantly going to be learning that I need to think about to navigate professional spaces with that reality, to navigate romantic spaces with that reality, to navigate friendships with that reality, right? And so acquiring those skills to be able to do that kind of work is what therapy could be used for, and that we think about kind of aiding in that ongoing healing process so that when we confront these new challenges, we feel equipped or supported and feel like we have a supportive space to navigate them.
Yeah. I mean, when you bring it from that perspective, it really highlights that it's just you need to be able to be adaptable, to be able to move through all of the things. Then the next myth would be that you have to stay with the first therapist that you choose.
Get out!
Yeah, let's normalize dumping the therapist if necessary. So one thing that I'll say is, like we said, it's not one size fits all, right? There's a bunch of different modalities. There's virtual versus in person, right? There's, individual versus group, right? And so, when thinking about this, you first want to find the person that matches your needs. But if you're working with them and a month or so passes and you're feeling like things are a little off or maybe aren't hitting at what you need, you can bring that up. But you can also say that this is not working for you and you don't want to continue. That is okay, right? There are some telltale signs that a person might not be the right fit. Obviously, if they're speaking out about things that are inappropriate as far as their personal information goes, or kind of taking up too much space in your sessions to talk about themselves versus you, that probably is an individual who might not be the right fit for you. There's other things to consider, right? Like pricing, right? How much is the cost, and is it feasible for like
Sure.
your lifestyle and the things that you have going on? Also time, right? Are you guys, the schedules like fitting, right? Does it fit with your lifestyle and all the things that you might have going on in addition to the time that you're going to need to take out for therapy, right? Even thinking about maybe like the modality in itself. Is CBT helpful for things that maybe are more relationally focused?
Sure.
Or vice versa? Would psychodynamic be helpful for someone who is needing help with OCD? Probably not, right? There are specific gold standard treatments that are perfect for specific symptoms, but if it doesn't feel like it's working, it's okay to switch and find someone else. And then some other barriers too, like emotional ones would be like, not feeling ready, to open up. If you don't feel like the space is safe enough for you to open up, that's something to either be discussed with the therapist or a direct reason to leave. And then access, again, you want to make sure that it's accessible to you. You shouldn't have to drive 3 or 4 hours to be at an in-person session, right? If you're doing it in the house, make sure you have privacy so that individuals can't hear you, and it's the same as an in-person session. But really making sure that it's in your reach and it's not something like you're fighting to get to. It shouldn't be. It should be made accessible to you.
Absolutely.
Yeah.
We often talk about picking a therapist like dating, right? Like the idea is that you don't just settle necessarily on the first person that you go out on a date with, but you maybe go out on a couple of dates with a couple of different folks, and be able to determine whether that there is that level of compatibility there. Now, one of the things is that if you're using insurance, it's helpful for the therapist to know if you are looking to switch someone. So sometimes with insurance, that can't all happen at the same time. You can maybe, do 2 or 3 sessions with someone and then let them know that, you'll be looking at maybe potentially another therapist, if that's what you'd like. You can do consults or consultations. A lot of therapists offer usually 15 to 20-minute consults to be able to see if you'd like to work with them. You can use their website or, pages on some of these groups like Psychology Today, Therapy for Black Girls, to be able to see if they're a good fit. But usually there's some, kind of barriers to trying to see 2 people or 2 or 3 people at the same time. But you can see them at different times and then make some decision as they're, as far as that's concerned. It's expected in the work that we're doing.
Yeah. And, don't feel bad, We as therapists, we are equipped with handling that experience.
Absolutely. All right, we're getting down to our last couple of myths today. So this one says, if you're strong, that you should handle things on your own. And I will admit that is a myth, even that I had to navigate as a therapist to be able to release. I think it probably was more rooted in, being a member of the Black community, thinking about being a Black woman, being able to navigate things on one's own, and that, one of the pieces of evidence there is you don't need help. But the reality is that, being able to admit that you need help is really a true reflection of strength. And oftentimes it is the strongest folks that are being asked to carry the most burden, and should be able to get as much assistance as other folks. When we think about, strength, I think in the spaces that we occupy, that is what is seen as strong, like someone who can readily not just regulate their emotions, but also communicate when there are areas of deficit and not continue to operate in ways that may make themselves a liability. I think about times that I've had to be sat down because I'm operating beyond my capacity, and it could become dangerous for the people that I'm connected to in ways that I wasn't considering, trying to just present myself as strong. And so when we think about how we might classify things that look like strength, there's a level of benefit that can be had from like relieving oneself of carrying the own burden.
Absolutely. Yeah, I agree. I definitely myself have been learning that lesson. That I need to reach out for support as a therapist, reach out for support from my supervisor, but also, colleagues,
Yeah,
getting
absolutely.
understanding of like the networking community and, really getting out here and building connections with individuals who are not only there for professional reasons but also just to know you're not alone as a
Absolutely.
therapist.
Mhm.
Although we may have all of this knowledge and all of these skills, the bottom line is that we are just humans too, and so we do need connection. And same for our clients. You can't do this alone. You
Absolutely.
cannot do it alone. And if there are people in your world who feel safe, who are trusted, who are people who can support you through the process, reach out to them.
Absolutely. Yeah.
So the final myth is that therapists can fix you, or that therapy is forever. And I don't think the hypothesis on that one has been supported. I think there are definitely people who have benefited heavily from therapy, but no human needs to be fixed.
Yeah.
You're human. Your experience is real. It is valid. And you there's nothing wrong with you, inherently wrong with you, if you're seeking support or need therapy to better your life. The client has responsibility in the change process, though. We are not just going to throw at you all the skills and techniques. We want you to come ready, right? And when you show up, you're saying you're ready, right? There may be resistance that happens throughout the process. There may be experiences where things feel like scary, or you have apprehension, you're nervous, you're worried, but to give yourself the opportunity to dip a toe in, right? You don't have to jump full first into the pool, but try it. Try the thing that might be a little bit scary. Try the thing that might be a little bit hard. That might be what you need to build resilience to do more. It's a tool. Therapy is a tool. It is not forever. Now, there are people who have been in therapy with the same person for 10, 20, 30 years. I, don't know why, but they have been. And it can be helpful in that. But the therapy process should be based on what you want. It should be based on the timeline that you see fit. And if at one point in your therapy timeline you feel like, hey, I feel pretty good, I got a handle on things, why drag it out longer? Also, you can find yourself coming back. You can come back to the same therapist. You can find someone new, right? So just because you stop therapy doesn't mean that, you can be done with it forever. If you want to come back, you can come back. But yeah, for different things, you may need something, shorter or longer. For trauma processing, there are brief therapies, but there are longer ones, right? And same for like the psychodynamic or psychoanalytic approach. Sometimes they, can start off at 1 year as a short-term therapy. Sometimes people are there for years on end, but it's all about what you need that really determines how long it's going to take. And then also whether you want to remain in that relationship or not, which you do have a choice about. So.
Right. And it continues to be a collaborative conversation with your therapist, and can be. And I think for therapists out there, sometimes we are, taught that there will be this, big aha when it comes to being ready to graduate or terminate someone from therapy. But I think sometimes it's the reality that, not that folks don't have any other problems, but the reality that they're navigating problems in a way that feels comfortable for them, where they've taken you and they put a little you in their back pocket and they've been able to carry you around with them. I think about a client recently. We started having this conversation where I looked and I said, while we meet bi-weekly, we're coming up on 100 sessions. And what does that mean in terms of the length of time that we've been meeting? And I think they may have felt like, because this has been, there's a lot going on for them and there's a lot of change happening, that this is the worst time to be having this conversation. But I think from my perspective, it's like, yeah, but you're handling it. If we think about who you were when we started and how you would have handled what's going on then, like with that piece, the things that we maybe haven't been able to, kind of develop together over our time, it'd be a different conversation. But like, you're handling it like you've gained something over the time that we've been meeting. And to me, that's the perfect time to graduate, where there's a level of success, there's been that transference of skill, and you can see that even new problems being presented are being able to be handled in new ways.
Yeah. When it becomes more adaptive and you have the resilience, you hit your mark. So as we wrap up, here's what we want you to take with you. Therapy is personal, flexible, and absolutely not one size fits all. There's no single right way to do therapy, and it's okay if you feel hesitant or unsure. That hesitation is normal. What matters is staying curious instead of letting the myths make the decision for you. We would love to keep this conversation going, so please share some of the therapy myths that you've heard or even ones that you've believed in the comments. Let us know what questions you have or what topics you want us to cover in future episodes. And if this episode made you think of someone who might need it, please share it with them. Sometimes one conversation can be the doorway to support. Thank you for tuning in to Real Talk with myself, Dr. Denise Watkins, and Dr. Erica Dawkins. We're here to keep the conversations honest, healing, and rooted in the realities of our community. If you found today's episode meaningful, share it with someone you love, and don't forget to subscribe, rate, and leave a review. You can follow us on social media for updates, resources, and behind the scenes moments. Until next time, keep showing up, keep speaking truth, and keep doing the work. This is Real Talk.